Maternal fetal medicine really is quite a new subspecialty. It came about because within obstetrics it became clear that we needed a focus on high-risk pregnancy.
It's no use having a diagnosis of a fetal problem at birth like we used to have. Now we take it back to 18 weeks of gestation.
Two things coincided. Recognition of a need for greater focus and care of high-risk pregnancies, and also the development of ultrasound technology that gave us the opportunity to see the fetus for the first time and to be able to diagnose conditions that we could never have seen before.
The impact these services had on the community has been huge, I think, because we're certainly the place where people are referred when findings are unclear from other imaging or there isn't the treatments available in other centres.
I think we've got the only true mothers' hospital in the country, internationally recognised in many areas.
Fung Yi Chan, who started up the service, was an amazing leader. She was very inspirational to me, and she also had a very collaborative approach. So she worked well with the neonatologists, particularly David Tudor-Hope.
Fung Yi was quite a remarkable lady. She was recruited from Hong Kong. She was the first obstetrician in Queensland to get her maternal fetal medicine specialty. And she was a very dynamic, persuasive, energetic lady.
The service had completed a special first, and that being the very first laser surgery to be performed in Australia for twin-to-twin transfusion syndrome.
And that completely changed the management of that condition from a 50% survival to about 80% survival for these babies. Monica first came to the Mater and she developed this problem, and Fung Yi Chan was the doctor who was looking after her at that time.
After about 3 ultrasounds over the course of a week, Dr. Fung Yi Chan sat me down and told me my twins had twin-twin transfusion syndrome. They had a 60% chance of surviving. So it was quite, as I understand it, quite a complex operation for them to do.
To actually do the surgery and then see that the changes that we're seeing had stopped and reversed and gone away. The first few times we were seeing it, I just remember being blown away really about how dramatic the effect of the surgery was and how it did work and did what it was supposed to do.
Amazingly, they've gone through school. They've been able to go to university. They've just finished their first year of university. But I think now that they're 18 years old, they are realising and appreciating the significance of their birth and also of fetal maternal medicine.
Later on in 2016, we expanded our repertoire with fetal surgery to open fetal surgery, where we did our first spina bifida repair.
So we had 2 babies diagnosed with spina bifida before half, and all the scans were fine, and they gave us extra ones. So the 12-week scan looked all right, and then at 16 weeks they said, actually, this little baby has spina bifida too, and we were just devastated. But I did ask, was there anything new that was on the horizon? And just by a very bizarre coincidence, Dr. Gardner was performing the first in utero surgery 2 weeks after that diagnosis for us. So we flew up to Britain and met him, and thank goodness we did. We both had a very strong feeling that it was going to be fine. And we didn't actually anticipate that it was going to be as fine as it turned out for Harvey, because he's doing remarkably well.
Things happen sometimes where there is no kind of guide, and we have to do the best we can. One of those cases that really resonates with me on that topic is Kim Bogatek and her son Taj. The unborn baby was what we call hydropic. It was swollen up with fluid, in heart failure, and really we thought was going to die.
Each time we went to see him, this is looking better and things are going well, and just sort of continued to improve from that first meeting.
And so we asked him if whether she'd be okay with us trying something that hadn't been done before, and that is to put a shunt in and try and drain the fluid off from the chest. Fortunately, it worked. It was very successful. Taj is a healthy lad today.
He loves his little kickers soccer program and swimming lessons, and riding his bike to the beach, and he's just a normal kid, I suppose.
Yeah, you don't think about it too much on a day-to-day basis anymore. Dr. Gardner and the whole team at Maternal Fetal Medicine were just amazing. They're just a wonderful team, and we're so thankful to them.
So, we've been able to help pregnancies progress to a time when the babies can be born and survive. We've treated women in utero that haven't been able to be treated before, so it's very satisfying.
I've been doing this for quite some time. I really wish I was 25 again and start all over again. It's going to be an incredibly exciting next few decades in this field. It's been an absolute wonderful time to have been involved with the service that we have here at the Mater.
There's something really important about being given hope, particularly for people who are in a situation where they've been feeling hopeless. Just something about being able to do something positive for your baby it was helpful.